Okay, so we're going to talk about hepatitis, chapter 31, your Williams and Hooper. So hepatitis, what is hepatitis? If I can get my screen to work. It's inflammation of the cells of the liver. So hepatitis can be caused by multiple things. A lot of us think about hepatitis B, and when you hear somebody that has hepatitis, you think of alcoholism or you think of hepatitis B. Well, there's lots of different reasons for someone to get hepatitis. It can be a bacterial infection that attacks the liver and causes the liver to malfunction. It can be drugs, alcohols, or any chemicals that are toxic to the liver. Many medications that we give our patients in today's time have a hepatotoxic label, so it may be toxic to their liver. So I would, it's something that a lot of times if the doctor prescribes a medication, they'll make them come back in like 6 weeks and have the liver function studies checked because we know that it affects the liver. So we will do those kinds of things. Sometimes it can be a metabolic or a vascular disorder. Maybe we're not able to get the blood supply to the liver, but often it's caused by a virus. So these are just all of the different ways that someone can contract hepatitis. So it's inflammation of the liver, the cells in the liver, usually caused by a virus. So we're going to talk about those types first. Let me go back here. So we're going to talk about the types of different hepatitises that we have. One is hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. There's a lot of hepatitises. So hepatitis A, we do have a vaccine for that one, and it is spread through the fecal-oral route. So we see hepatitis A in places where people are, maybe restaurants, maybe bussers, people who are cleaning up tables, people who are, maybe not washing their hands, daycare centers, things like that. So that is the fecal-oral route, and that's hepatitis A. Then we have hepatitis B. This is from blood and body fluid. So this is if you get a splash in the eye, if you get a needle stick, however you contract the disease. Hepatitis is very, very virulent, and it does stay alive on dry surfaces for quite some time. So it is something that as healthcare workers we worry about. Most of us have all been vaccinated against it. Hepatitis C is blood and body fluids. And we're going to talk about each one of these. Hepatitis D is also blood and body fluids. Hep E is water contamination. So we don't really see that in our country, but we may see that in other countries where maybe water sanitation isn't like it is in our country. So prevention. How do we prevent the transmission? Well, it's standard precautions. If people have hepatitis, we do not put them in any type of special isolation. However, with your standard precautions, if you should be wearing gown, glove, mask, and goggles if you're going to come in contact with any type of bodily fluids, splashes, anything like that. Hand hygiene is vital. So when you go back to infection control, hand hygiene is going to be critical in making sure that that is getting done. Now, we do have vaccines for hepatitis A and hepatitis B. So we do have those vaccines available, and they do give permanent active immunity. So once you get the full series of vaccines, you have permanent active immunity. Now, like hepatitis B is a series of 3. I think hepatitis A is a series of 2. So you have to make sure you complete the series. Many times if you've had it a long time ago, they'll go ahead and draw some antibodies for it. And if you don't have antibodies, they'll go ahead and give you a booster. But it should provide permanent active immunity. So if you get exposed to it, your body will already recognize that as saying, oh, I've seen that before, and start to fight that infection off. We can give you immunoglobulins. An immunoglobulin comes from a plasma donor, and it's good for 3 months. So if we got somebody that was exposed, we can give you the immunoglobulin and hopefully protect you from developing the HBV. And then, public health measures, just making sure that we're keeping everything good and clean and wiping out all of our surfaces, handling the waste products the way that we need to be handling those. So if you would happen to develop hepatitis B, here's the signs and symptoms. It usually comes in 3 stages. You have a prodromal stage, an icteric stage, and a convalescent stage. So the prodromal stage usually lasts for about a week. You have like flu-like symptoms. You get right upper quadrant pain. Some people may mistake this for gastroenteritis or a tummy bug. Then you go into the icteric stage. This is where you're going to get some jaundice now because the liver is starting to be affected. The liver is not functioning like it should. It's not able to rid itself of the red blood cells. So we're starting to get some jaundice. And then you're going to get worsening symptoms. And then we're going to, once you get over that, that takes 2 to 6 weeks, then you're going to go into that convalescent stage, which lasts from another 2 to 6 weeks. And that's when your liver is going to return to normal liver function. Hepatitis V can be very debilitating. Most people are going to be off for quite some time if they get hepatitis. And hepatitis can actually, this hepatitis B can actually be fatal. So we always want to make sure that we're, taking care of our patients and making sure they're taking, supportive care measures and making sure they're taking care of themselves during this process. Okay, so complications of hepatitis. Now this can be from any type of hepatitis. This can be from virus, this can be from bacterial, this can be from chemical, this can be anything. So it can be sometimes complications from hepatitis can be acute, which is rare. Rarely do we get acute liver failure. But if we do get acute liver failure, it's typically going to be from an overdose, such as acetaminophen or your Tylenol, where we know that acetaminophen directly targets those liver cells. Now, chronic liver failure is typically going to be from cirrhosis. Now, cirrhosis doesn't have to be alcohol cirrhosis. It can be other forms of cirrhosis that has nothing to do with alcohol. It could be medication cirrhosis. It could be different types of cirrhosis. Chronic infection can be a complication from hepatitis. Sometimes people can be a carrier. You don't personally have the disease, but you carry it, and you can pass that disease on to other people. If you do have hepatitis or you are a carrier, it does increase your risks of having liver cancer later on down the road. So it's something to kind of think about in the process. So I kind of did want to go back to hepatitis C. If you want to just go back real quick to hepatitis, it's not going to go back. Hepatitis, well, we'll go forward. Hepatitis C. Hepatitis C, there is no cure. However, there is a new drug out for hepatitis C. It's called Harvoni. And it is, I'm not exactly how it works. Somehow they give you an injection and it makes your body recognize the hepatitis and start to kill it out on its own. However, it's very, very expensive. I think it's like $10,000 for treatment. So it's very expensive, but it is out there, and it does, as far as the studies go, it really is treating hepatitis C very, very well, and people are living a long time with it and actually being cured from it, where before the only treatment we really had for hepatitis C was a liver transplant. So we've come a long way with a lot of our things that we've done. So back to hepatitis. So how do we diagnose hepatitis? How do we know somebody has hepatitis? Well, we're going to look at some blood testing. You can't just look at somebody and go, oh, you have hepatitis. You have to diagnose it. You have to get your diagnostics to know what they have, because that helps us to be able to treat the type of hepatitis that they have. So we're going to look at liver enzymes. Specific liver enzymes is your ALP and your ALT. Alkaline, something, phosphate, but I usually refer to them as ALP and ALT. Those are your liver enzymes. We're going to look at your serum bilirubin. You really shouldn't have any bilirubin in your body because your liver should excrete it through your body, so you shouldn't have any bilirubin. However, we could draw a serum bilirubin if you have higher levels. That means that your liver is not functioning as it should, so that's something that we would look at. Prothrombin, sometimes we can look at prothrombin tests, and if you have a long clotting test, because clotting factors are made in the liver. So a lot of your clotting factors are made in the liver. If your liver's not working, you can't make the clotting factors, so then you can't clot, so you end up bleeding more. So that prothrombin time tells us how quickly that you're bleeding. And then we do lots of serological tests to determine what you are. One of the other things we can do is a liver biopsy that's going to be very diagnostic and telling us, yes, this is what they have, this is the type, this is where it came from, this is how they got it, and this is how we're going to treat it. So liver biopsies kind of very diagnostic in which kind that you have. Okay, so therapeutic interventions. Well, first of all, we need to identify the cause, just like the blood tests and liver biopsy is going to do. We're going to monitor our liver function. So we're going to look at those serology tests, and we're going to try to relieve their symptoms. If it's a virus, there's not a whole lot we can do for them, but supportive care, taking care of them, keeping them healthy, eating right, providing certain things, and prevent cirrhosis. So we want to prevent the liver from getting any worse than it is. Make sure that they're hydrated, so they need to be getting 2,000 to 3,000 milliliters of fluids per day, making sure they're eating good foods and nutritious foods, and making sure that their protein levels are good. And we want them to rest. And they need to avoid any alcohol and any liver toxic drugs. So if they're on a drug that we know is hepatotoxic, we need to get them or wean them off of that as quickly as possible. More interventions. So as far as hepatitis A and hepatitis E, there is no really anything that we can do for that. So it's mainly supportive care. What we mean by supportive care is treating their symptoms. So if it's dehydration, we're going to give them fluids. If it's pain, we're going to give them pain medication. If it's other things, we're going to treat those symptoms. That's what we call supportive care. HBV and HDV, we're going to give them some pegylated interferon therapy, and I'll talk more about what that is here in just a minute. HBV, if we have hepatitis B, we can give them antivirals. Certain antivirals will work, but if you can remember that chemical makeup of our viruses, they live inside our cells, so it's really hard to kill a virus. So we can try to use antivirals to assist, but we're also probably going to do supportive care for them too. We can do the interferon, and we can do a liver transplant. So those are things that we can do. But to get a liver transplant, we're talking about a lot of steps. Hepatitis C, I think I already talked to you about the Harvoni drug. It's a antiviral medication. I've always heard it called Harvoni, but the generic name would be sofosbuvir and lenacapavir. It's probably two drugs that are put together. And there's certain genotypes with hepatitis C that we can use this interferon therapy. So what interferon therapy is, it's just substances produced by the cells to help our body fight infections and tumors. So we give them interferon, and it helps our cells to fight off the infection. So we use our own immune system. Using interferon, we trick our immune system to knowing that, okay, we have something foreign here and we need you to fight it. So we kind of use our own body to help do those kinds of things. And that's what interferon therapy is. And we will stop right here on our hepatitis, and we'll move to HIV here in just a minute.